Hello people, it is your favourite cancer patient updating you on the health situ. Please excuse the fact that I have no makeup on and I look absolutely rancid. Rancid. Good old chemo. Yes, so I had my catch up today with Dr. Madhu and had my scan results as well at the same time. So in a nutshell, they were quite positive. Brain is pretty much showing even more reduction that was already, it was reducing anyway, but there's more reductions in certain tumours in certain places in my brain, so that's ace. And body wise, everything is just holding stable at the moment, so that's pretty good. But the only issue is I've had 6 lots of the paclitaxel, which has been working the magic, if you like. However, I'm actually going to have to stop that now because I'm starting to get neuropathy, I think that's how you pronounce it, but like the feeling in my fingers is starting to go. My nails and hands are horrific. I don't know if you can see the rash that's on there at the moment, but it's bloody sore. My nails look like smokers' fingernails, which again is the effect of the paclitaxel. So he didn't want to continue on it because I've had 7 rounds of it now, and ideally you should only be having 6 anyway. And he feels that I need to take a break from chemotherapy smashing me constantly, because there's a chance that I'll get some levels of toxicity, which I do not want, because that can make the side effects permanent and it's gonna mean that my body's gonna start shutting down basically. But on the positive side, he also mentioned to me about starting some hormone injections, which is to lower the estrogen within my body that my body's creating naturally, as ways of trying to sort of maintain that control over things progressing basically. And I started those today randomly. I thought it would wait until perhaps the chemo's out of my system, but I just went, okay, let's go for it. So the injections, there's 3 of them. The first one is something called denosumab, which I've had before, and that is to help my bones and the calcium levels in my body, but mainly to help my bones because I've got cancer in all of my bones. It's just to try and give them a bit of a backup protection, if you like. It's to strengthen them. So that's pretty basic. I don't think there's many side effects with that. It's mainly sort of like bone pain, things like that, but I have that anyway. The next one is Zoladex. That's another hormone related injection which goes into your tummy once every 4 weeks, and it's like a little implant that gets injected into your stomach fat, and it just again brings down your estrogen levels within your body. And then the final one is something called, I always get the name wrong of this, so I'll have to grab the leaflet, bear with me. Faslodex, aka fulvestrant, but that one is for, I've had the initial injections today, I've got to go back in 2 weeks' time to have the other injection, which is like the loading dose, and then it'll go on to 4 weekly injections, and that one is injected into your arse cheeks. Joy, oh joy. And I'll tell you what, it is quite uncomfortable, especially when you've lost lots of weight and you don't have much of a bum on you anymore. So yeah, that was interesting. Not looking forward to the next one, but hey ho, just you do what you got to do, don't you? Side effects of that is like nausea, bit of pain at the injection site, potential rash, all the normal blah 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 blah. But the advantages with these 3 hormone maintenance injections is that it won't be attacking my healthy cells like the chemo was. So this will mean things like my hair possibly might start to grow back, and my immune system won't necessarily be affected by these injections, which will mean I can take a little holiday with Charles, which is what I'm hoping to do, and my fluffies, and I suppose just enjoy myself a little bit, because, sorry, I'm wriggling around because I'm trying to get myself comfortable and level with the laptop, because after having those arse injections today, my arse is very sore, and so is my tummy where they've done the implant injection, because they're not small needles, and the one in the bum, it's quite a large amount of liquid, and they have to do it quite slowly into each buttock. So I haven't even got like one cheek that I can rely on at the moment, or sit on without it causing some sort of discomfort. Joy, oh joy. And this, yeah, the scan results were pretty positive, but I have a feeling I might be going to my private oncologist about starting the lapatinib that I was on about a couple of updates ago, which will cost money, obviously, and it costs to go and see him for an appointment as well. But just to try and keep these brain mets stable or reducing, which they're doing at the moment, which is great. So I will make an appointment to go and see him anyway. But in the meantime, I'm going to go ahead with these injections and wait and see, you know, how they make me feel in terms of well-being and quality of life as well. And then hopefully at some point over the next month or so, 2 months, I can have a bash at the lapatinib. I'm a bit nervous about that actually, because if anyone can remember when I had my first dose of radiotherapy a couple of years ago now, I think, they tried me on the neratinib and I had a reaction to it. So that's either going to go one way or the other. Either I'm not going to be able to take it because the side effects or the reactions are too intense, or it might work because it's the sister drug to the neratinib, which is now used by the NHS. It's the older version of that, and unfortunately the NHS won't have that anymore because the new drug is now what they use. So we shall see how that goes. But in the meantime, I am just trying to recoup a little bit, is probably the word that I was looking for, because even if they wanted to carry on with this paclitaxel, I think I would have requested to have some sort of holiday or a break at least, because at the moment I feel like I'm just getting absolutely smashed. Probably because I am every single week for 3 weeks, and then I have a week's break, and then it's getting smashed again for 3 weeks, and it's a week break, and that's the sort of routine I've been in for 7 cycles now. And there's 3 chemotherapies in every cycle, so that's quite a lot of chemo. And Dr. Madhu also highlighted to me that I've had 6 different types of chemotherapy over my whole time with cancer, and that's quite a significant amount. So that's probably why my body's going, can you just give me 5 minutes? Freaking Kit Kat and a cup of tea, you know, that kind of thing. So yeah, it's bittersweet, but I'm just hoping to be able to do a few nice things now, and I've got the fund money thanks to all you guys as my backup, and I don't know how far it will take me in terms of paying for the treatments and the appointments, but at least it's there and accessible and sorry, and will be helpful, really helpful. So thanks to all you lot, I can continue on my path of trying to not cure myself, but at least have a little bit more time, which is important. And it's not an easy thing to accept the fact that you're not teetering on the edge, but it's trying to find that balance of quality of life and survival, and obviously to have any kind of quality of life, you don't want to be in bed like feeling knackered all the time, or putting yourself at risk every time you go out somewhere. I mean, I do have my down days, I won't deny that, but I've also had some really good days of late, and I think, as far as I'm aware, my heart and lungs are playing ball at the moment. I've got a little bit of a cough, but that's just from the chemo. It makes me a bit dry and claggy, as you can see from my mouth. Lovely. Bit of dry mouth and mucositis. Yay, chemo! So yeah, it's going to be interesting over the next few months to see how everything sort of pans out. And it's kind of difficult to accept the fact that I've just got to go with the flow, and I don't actually know, again, what's going to happen. But I feel like I'm being looked after by Dr. Madhusudan at the City Hospital and Dr. Chan at the Park Hospital. But if anybody's sort of got any questions or anything, you know, you can always ask me. I'm not afraid to talk about it, and I think that's all really I've got for now, but I will let you know, because obviously I want to keep everybody in the loop, especially friends, family, and just people that have donated to my cause. I feel like, you know, you deserve to know what's going on and how your money is essentially being spent. But I'm forever grateful, and it has died down a little bit, over the past few months with Christmas and New Year, and people are like, you know, we spent quite a lot of money, so like we've given what we can, and I'm still getting the odd donations trickling in, but it's kind of reached a stagnant point, so I should imagine I'll be geeing up the JD Best page, the JD Best people, to do some more fundraising. I've been doing a little bit of my own fundraising, not me standing there with a coin pot going, can you spare a few quid, but sort of dishing out posters and collection pots and bits like that. So, but every little helps. And I think potentially going forward, I'm not quite sure what I was going to say there. It's gone. Chemo brain probably. But thank you again. Sorry if I seem a bit spaced out. Maybe a side effect of these arse injections. But yes. Oh, and another update is that Charlie has gone back to work. He's been back at work now for a few weeks, but it's only part-time, so he's doing 2 or 3 days a week, just to keep things ticking over, keep money coming in, and obviously my mum's here 24/7 pretty much, but she tends to stay when he's on earlies or night shifts. So he is sort of in and out of everything all the time, but he's a good husband, brings me breakfast in bed, makes my dinners, does all the housework, walks the dogs, so he's pretty amazing, really. This is like the longest video ever, I'm really sorry, but I suppose it's because I haven't done one for quite a while, so I feel the need to kind of update you pretty much on everything. But I don't think there's anything else really. Had a fantastic Christmas this year, thanks to the good results from just before Christmas. And I actually got to eat my Christmas dinner and spend time with my friends and family over Christmas and New Year, which is invaluable, basically. Yeah, I shall leave it at that, I think, end on a positive note. But I shall update you, as I said, once again, when things are moving a bit more and I've got a few more appointments in, and had a chat with Dr. Chan about the Lapatinib, the cost of all that and everything. It needs to be rebooted and rerun over so I know what's going on. At the moment I'm just trying to process everything a little bit. I'd describe it as being like a pile of leaves that just gets chucked up in the air when it's really windy. So like I've got everything going all over the place, so I'm not really 100% sure of what's going to happen and how it's going to happen and the effects of what's going to happen. So bear with me. I'll do my best, and obviously I'll try and respond to everybody and see people as much as I can. But yeah, the next 2 weeks shouldn't be too bad. So then would be a good time if you want to see me or speak on the phone or whatever. So ta-ta for now. I'm gonna go and get my dinner. It's a bit late, but need to eat something. And I shall talk to you all soon. Peace out. Love you loads. You're all amazing. Bye.